So let's talk about the headlines in the papers today. Christmas in jeopardy, new strain and more pain. The Express here with fears over new fast-spreading COVID strain. That is what we're worried about. The Health Secretary yesterday in the Commons announced to MPs about this new variant of COVID-19. Let's have a look at what he said.
Initial analysis suggests that this variant is growing faster than the existing variants. We've currently identified over 1,000 cases with this variant, predominantly in the south of England, although cases have been identified in nearly 60 different local authority areas, and numbers are increasing rapidly. There is currently nothing to suggest that this variant is more likely to cause serious disease, and the latest clinical advice is that it's highly unlikely that this mutation would fail to respond to a vaccine. But
OK. Sorry to interrupt you, Health Secretary there. Let's go to Dr Bharat Pankhania, who's a senior clinical lecturer at the University of Exeter Medical School. And very scary, this. I don't know if the statement or the information was designed to scare with the extra mixing, Doc, that's coming up before Christmas. What is your interpretation of what Matt Hancock said yesterday?
We have a new branch to a tree. That's the best way to describe it for our viewers and listeners, in that if you imagine a large tree and it produces a little branch and then that branch becomes a main trunk, that's the best way to look at it. It doesn't mean that this virus is so new that our existing immunity will not work against it. And it definitely doesn't mean that the vaccines will not be effective against it either. Because and it's a if the spike protein, that's the bit that attaches to the human cells that causes the virus to then enter the human cells and infect us, is so different, we can re-engineer the vaccines for it. It may just be that it is more infectious. And if so, we have to also undertake good infection control measures not to get infected.
Well, so I just wondered, is Christmas a good infection control measure then, in your view, as a clinician? That must fill you with horror.
I'm very concerned about Christmas because case numbers are high leading up to Christmas, and we have evidence from other countries where people get together for festivities and then the case numbers shoot up. So if people are having a second thought about Christmas, my advice would be good times are not far away with the deployment of the vaccines, and therefore consider having a low-key Christmas 2020 and celebrate big time in 2021.
And do you believe that this variant is more dangerous than the one that we've been experiencing?
No, there is no evidence to suggest that it has changed in such a way that it is now going to cause more severe illness. What we do know, and it is also in balance, is it may be more infectious. And that means that you need perhaps a lower number of viruses to set up an infection inside you. And again, that is not absolutely confirmed, but that would be one hypothesis to test out.
OK, Doctor, really appreciate your take on things there. Thank you very much indeed. Dr Pankhania there, he's a senior clinical lecturer, University of Exeter there, with his view on that. So basically he was saying good times around the corner for all that. Morning View, let's go into Willoughby with her take on that. You hear what the doctor is saying there. Surely we can postpone, surely we don't have to be as indulgent, surely we don't need to mix with so many people at Christmas, he's implying.
Correct. We need to employ common sense, as we should have been doing from the very start of it. It's very reassuring to hear that the new strain isn't going to be any more dangerous than the previous one, but it's that catchability factor. And when you're out and about in the shops and they're keeping Oxford Street open, the busiest shopping street in Britain is going to be open despite it being tier 3. When you're in Topshop or Gap or wherever you're going in London to do your shopping, aerosols, the little droplets that people breathe out, not even from shouting or spitting or anything like that, they just naturally come out. They can hang around in the air for up to 3, maybe 4 hours. So it's really important that we carry on wearing the masks.
OK, I'd like to know what you're going to be carrying on doing, Andrew Neil, there also with his view on Morning View today, because what was behind what the Health Secretary had to say yesterday? Do you think he was saying basically, oh, everybody, there's a new strain here, this is taking a bit of a twist, we don't want to tell you to cancel Christmas, but that's what I sort of read into it.
Yeah, me too. I think ministers are getting very worried about the liberalisation around Christmas time, the 5 days. Almost no other country in Europe is doing that now. Indeed, everybody else is moving to tougher lockdown situations. In France, for example, the curfew will only be lifted for Christmas Eve, not even Christmas Day, not even New Year's Day. I think they're worried that the number of cases in the second wave is not going down nearly as quickly as they thought. This new strain, although I'm told by the experts it's what we should expect, but nevertheless causes added worry. And I think people are wondering why we're going into a very tough lockdown before Christmas. Suddenly it gets lifted for 5 days, and we're probably going into an even tougher lockdown after that. And it doesn't really quite make sense.
Very difficult time for the hospitality industry, isn't it, at Christmas? So they've been allowed to open, they would have been preparing for this time, getting stock in, and now they've been shut down again in some areas, not everywhere.
Yeah,
it's a disaster.
We're looking at maybe 5% unemployment next year. That's what the indicators are showing us. We've had close to 900,000 redundancies already, a lot of those in the hospitality trade, and more to come, because let's not forget, we still have furlough operating, which is disguising that figure. So really tough times. And, you know, there's no end in sight for those poor people working in that industry.